Encounter is brought to you by the Broome County Council of Churches, where we connect compassion with needs as we inspire growth with dignity. You'll find us in special places throughout the community. For those who remain hungry, we provide meals. For those who are challenged, we build wheelchair ramps. We comfort those who are ill, minister to those who are confined, and we remain an advocate for change and understanding on behalf of every element of our community. Connect and inspire. Encounter the Broome County Council of Churches.
Good morning and welcome to Encounter. I'm your host today, Joe Sellepack. Along with many of you, I've been watching the news and reading things on Facebook about the COVID-19 virus that's going around, what many people are calling the coronavirus or the Nova coronavirus or the new coronavirus. We have a lot of information out there, a lot of information, misinformation, a lot of speculation. You see that March Madness has been canceled or that Disneyland has been closed down. And we have a lot of questions about where we are locally as a community and what the impact locally might be. And of course, these are things that very much concern us. Should we be concerned about the spread of the virus?
So I think now is the time to prepare. We still have no confirmed cases of COVID-19 here in Broome County, but it's not too early to prepare. As we see local spread in other parts of New York State, our preparations now will hopefully reduce the number of cases that we do have in the future.
My guest today is Rebecca Kaufman. Rebecca is our Director of Public Health in Broome County. Welcome to Encounter.
Thank you. Thank you.
So in general, I'm sure that some of our listeners may not even know that we have a Director of Public Health and what your job entails. So can you help us understand a little bit more about what you do?
Sure. So I'm the director of the county's public health department, which entails many divisions. We have our environmental health division that does restaurant inspections, water testing, hotel motel inspections. We have a WIC clinic that helps young moms and children with food and nutrition. We have many chronic disease grants. We have a clinic that has a walk-in STD clinic as well as TB clinic, immunizations, a whole wealth of services that serve the people of Broome County.
And how did Rebecca get involved in this?
So it's kind of the short version of the story is, since I was probably in middle school, I thought I wanted to be a health teacher. And I am born and raised here in Broome County. I went to SUNY Cortland for my undergraduate studies, and I decided, I'm not sure I want to be a teacher. And so I took this path of community health. My family, my mom was a nurse and my dad dispatched for the state police, so I knew a little bit about civil service, and I decided to take civil service exams, which led me to a role in Tioga County as a public health educator. I worked there for 5.5 years in a variety of roles, but leaving as their deputy public health director. 3 years ago, when our current county executive took office, I applied to be the public health director, and he put me in that role, and we've been, moving forward ever since. So that's how I ended up here as the public health director in Broome County.
And what kind of education does a public health director go through?
So there is actually public health law about what requirements they are. They're mainly master's level courses in public health. I have a master's degree in community health, again from SUNY Cortland, and then have taken classes beyond that at the University of Albany's School of Public Health. But it's one of those unique positions that the state actually requires what coursework we have to hold our titles.
And so when we're looking at an issue like the COVID-19, I didn't know that you could actually say that. So COVID-19. So when we're looking at that type of virus, how does that impact your job? Like where does that come in?
Well, one thing I definitely want the public to know is we monitor communicable disease and communicable disease spread all year. So the idea of having someone have a test to see if they have a disease, having the test results report back to the health department, and us talking to the person about what they've done in their day-to-day is not new. That's something we do all the time for, pertussis or measles or other diseases that we don't see that frequently, but there is monitoring and this idea of tracing people all year long.
Like hepatitis and AIDS and other things like that.
Yes, I think now, obviously, this COVID, there's a potential that we will be tracing many people, a much higher number of people than what we are used to. But we also have a division of the health department that's emergency preparedness planning, and we do plan for this all year.
So when you're thinking through an issue, when you're thinking through the COVID-19 issue that has recently come up, is it an overreaction on the part of Disneyland, for instance, to close, and why is that important for public health?
The idea of large public facilities closing is used as a prevention measure so that people are not in tight spaces, and also, if there is someone who has COVID, reducing the amount of spread that would have taken place. So obviously, the more dense population or the places we are where more people gather, if we have one case in that location, we are then going to be contacting, a large number of people, as opposed to if people, take a few weeks. Hopefully, we're not looking months into the future, but let's, lay low and help reduce the spread if we get to that point.
And so I had read somewhere that 80% of the people that contract COVID-19 don't actually exhibit any symptoms.
Or I don't know if it's that they don't produce any symptoms or the symptoms are very mild. So 80% of those who are contracting COVID, from what we can see, are able to stay home, use self-care, and resolve through it without any large health concerns. So I think a lot of times we hear of this being compared to the flu, which it's not the same virus as the flu, but we know some people stay home, take Tylenol or Motrin for their fever, and within a week, are really back to their normal activities. And then there are other people in the population who are at a higher risk to have side effects that may potentially have them have a hospital stay, which is what we're really trying to reduce. Those number of people, the vulnerable populations, whether they have a immune system, underlying health condition that has their immunity low, or they're senior citizens. Those seem to be the two populations that are greatest affected by this virus.
And how long can a person be a carrier of the disease?
So that doesn't have a clear answer at this point. What we do know is the incubation period seems to be 12 days. So right now, if we know you've had an exposure to a confirmed case, we are asking you to be in a precautionary quarantine for 14 days so that you stay longer than that incubation period of the virus. But in terms of how long it's actually in a person who's confirmed, we don't have an exact number at this point.
And so the reason that we do this isn't necessarily even, so if I have a mild case, I'm sitting there thinking, well, I could power through this, I could go to work, I could avoid taking a sick day or even avoid, I have to work through it because I'm an hourly worker. Why is it that it's important to stay away from people?
That is one of our number one recommendations, is that if you are not feeling well today, we really ask you to stay home. And all of the things that you were saying about, there are a lot of people who are saying, I can do it, I can go to work, I can make it, but we need you to protect your neighbors, we need you to protect your family and friends who can't who don't have the immune system that you have, or who fall into a high-risk category. And so really staying home when you're sick is one of the best advice we can give people right now.
And are there other precautions that people can take in order to avoid spreading the disease?
I mean, hand washing is always our number one thing, avoiding touching your face. A little bit about hand washing, I've heard, I think we've gotten kind of used to the alcohol-based hand sanitizer, and there are some retailers who aren't always able to stock it right now. But soap and water works just as well, if not better. Obviously, if you had any dirt or any debris on your hands, soap and water would get rid of that, where hand sanitizer wouldn't. And really using the full 20 seconds to wash your hands seems silly, but we kind of need to retrain ourselves. We're always in a very fast pace and nobody stands there for the full 20 seconds, but that is the best way to kill any viruses that are on your hands.
I hear people saying, well, sing happy birthday, or do the ABCs, or say the Lord's Prayer, or
and I think it's actually twice. It's happy birthday twice. I do know that.
So that's 20. That's what 20 seconds would entail.
Right.
All right. Very good. So, like in public gatherings, so congregations are a public gathering. What are some precautions that the space might be able, like people that manage the space might be able to take?
We are asking, if possible, to do extra cleaning. The one positive we have is that COVID-19 is not a very hardy virus. It is easily killed by cleaners that we typically use. So any of your household cleaners should be able to kill the virus, but the more frequently you clean, obviously, the more likely it is to not be on surfaces. That's another question I receive frequently, is how long does it live on a hard surface? And we don't actually have perfect science. It could be up to 2 to 3 days that it lives on a surface, but obviously if you're coming through with a cleaner, you're going to be able to kill that virus. It doesn't live long if it's been touched by a cleaner.
Now, when I was in a meeting yesterday with the governor's office, where they had faith leaders, and we were talking about what we might be able to do in churches in order to help deter the spread. And one of the things that they were saying was the back of the pews, making sure that hard surface was cleaned, and then making sure doorknobs and light switches were cleaned, and managing how often like bumping elbows instead of shaking hands, that kind of thing.
Right. In our culture, I think, we greet people with handshakes and hugs. Now would be the time to kind of start a new tradition there. I see people tapping elbows and, doing all kinds of things. And although that may seem silly, it does, again, put that protective barrier of people not kind of being within close proximity of each other. To your other point about high touch areas, is what they're calling them, people's phones, cell phones, keyboards, things that you don't always think about but you always have in your hand, are really areas that we're advising get cleaned more frequently. So I could see how you would put your hand on the church pew and maybe not even think about it, but yeah, just taking the extra minutes to clean those areas that are frequently being touched by many people will help prevent spread.
Now my guest today is Rebecca Kaufman she's the director of public health for the county of Broome County. So one of the other things that they were talking about was density reduction, and making sure that gatherings. One of the governor's proclamations was on reducing the size as well as the density within buildings. Can you talk a little bit about that?
Sure. So the governor asked that all events with 500 or more people at this time are being canceled or postponed. And if you have less than 500 people, making sure that the occupancy of the area you're in is only at 50%. So if you have a large church that maybe fits, 1,000 people, making sure you have less than 500 in the room. But this also could be, meeting rooms and conference space, other areas, kind of making sure we're providing distance between people. There's this rule of 6 feet between,
right.
which again, when you're sitting in a pew, is probably not realistic that everyone would have 6 feet between each other. But the idea that people have the ability to spread out and are not in that small condensed space is why the governor made this decision.
So some of our congregations, they have food sites where they serve food to the public through we operate through the Council of Churches a Broome bounty where we try to retrieve, and you probably know more about it than I give you credit for, because of course you are the director of public health. But we rescue food, but then it goes out to the public through these
right.
areas, and that food is served to in some cases like 200 people will be gathered. What would your advice be to them?
I have spoke with some of the community meal sites this week, and we've talked about different precautions. Can they require hand washing before they come into the meal? Again, if people are visibly sick, asking them to not attend the meal, but also some other ideas about, could you take your meal to go, or could things be done outside? I know right now that's hit or miss with the weather, but as summer comes, the events I least worry about are the outdoor events, because obviously there's a lot of space. So we've talked about some different ideas they could use, but again, really hand washing for people to make sure that if they have anything on their hands, they're not bringing it with them into the meal site.
Now we had talked to someone who was talking about that 6-foot rule. How might they be able to enforce that if they were sitting at a table, for instance?
Well, if you have tables in a traditional dining hall and you put, typically 10 chairs, can you put 6 and spread out, have more tables? Things like that, although it seems minor, it really is keeping people's space around them at a greater distance. And again, when the virus, we currently do not have cases in Broome County, but when we do, really just keeping that spread between people so that they're less likely, I guess, to attract it.
Now, earlier we had talked a little bit about that there are vulnerable populations that we're trying to protect by maintaining social distance and these other practices that we're talking about. Who would be in that population?
So the people we are most concerned about are people who have weak immune systems due to other health conditions, or people who are, senior citizens, but specifically 80 and above seem to be the most affected. And
so really, if some of our listeners may be within that vulnerable population, what would your advice be to people that are in that demographic?
I think it's hard, but depending on your family, your neighbors, your friends, I think if you were scheduled to go to a large event, this is probably the time to postpone something like that. People will say, well, why would we already do that? We don't have any cases. But honestly, once we start seeing cases, if community spread could have already occurred. So if you are in one of those high-risk categories, the time to kind of lay low and stay home would be now. People also are asking a lot about a specific timeline, which we don't really have. But I think, think about it as the next few weeks to a month. And, if you have someone offering to kind of bring groceries to you or bring things to you as opposed to you going out, now would probably be the best time to accept that help.
And so some of my questions too have to do with our pantry system. So a lot of the people who actually manage our pantry systems are over 70 years old. Many of them are, I think the average age is right around 71, 72. of our pantry system, because they're the ones that are available to volunteer more so than other people, and kind of constantly has been feeding that way. What would be your advice to people that are in the public and are volunteering? How could we help minimize the spread of, or the risk, so to speak?
The biggest thing for them would, of course, be hand washing frequently. If there is a way to, where within the place their work, add extra cleaning, that would be important. And if they are feeling ill, to stay home.
All right. And so one of the big questions too is, like, what is the role? Well, so I've heard they call it herd immunity, right? So what we're trying to do is kind of do something similar to that, where we actually protect the vulnerable by trying to maintain these practices for a period of time that will perhaps inconvenience us, but will help deter the amount. From what I hear, it's really deterring the demand of our medical, like a hospital ICU unit. We don't want to go to the route of like what happened in Italy, or what happens in other areas of the world. Can you speak a little bit about that?
Yeah, so the idea that if we, like I had said, if we people are always saying, why are we canceling events when we don't have cases? The idea that we would wait for cases to start popping up to start canceling events is probably too late. So I do applaud the governor in that he decided to make these decisions now, even though upstate has few cases. The amount we limit our group settings means the limited amount the virus can spread through those groups. For us to now put, 500 people from a vulnerable population in a room together would not be doing them, we would not be doing them justice at
no
that point. No
services at all there.
Right. So the idea is the more we can space out, let the virus have, a virus does have to kind of run its course, and it has reached New York. We've all seen what's kind of happened downstate with a large community spread, and we know New Yorkers travel. It's not like we're going to be able to, no one's going to be sticking to their one part of the state. So we frequently, have people coming from downstate and western part of the state, all over. So to cancel these events now and, kind of let the virus run its course makes sense.
And like SUNY even, I mean that has been a big piece of the conversation too. Canceling classes, going to more online. Is there anything that congregations might be able to learn from that?
I mean, I know it would probably be a large step, but as much as you can do things online and with use of technology, the better. We are kind of, I don't know if we haven't spoke about this yet, but nursing homes have also been restricting visitation as of, I believe, today. And I know locally at our Willow Point nursing home, we are going to start implementing bringing iPads in to try to use video chat. Obviously, many of the residents have not done that before, but with the assistance of staff and the legislature, the county executive approving, and then followed by approval from the legislature to purchase iPads so that the residents can actually try to virtually see their family. So that's not something that we, I think the younger people are used to. We haven't necessarily brought that to other generations, but I think, now would be the time to try it out.
And one of the other things that I've been thinking a lot about is making sure that you have a list of people who are shut in or in the vulnerable populations, so that you can be able to check in and make sure that they're doing okay. Is this something that neighbors could do for each other?
So I would suggest neighbors to check on each other if they're staying home just for their own protection. Once someone has actually potentially been exposed to a case, the health department then will be in contact with that person, and we will start checking in with them daily. Some in person and most by the phone, but
Right.
you know, if you have someone who's been potentially exposed at that point, I wouldn't have their neighbor check in on them except via phone. But you know, if you're just someone who wants to kind of stay home and keep yourself out of these larger public areas while this runs its course, then yes, I think using your neighbors and your family is a good advice.
Now, if a congregation is trying to think of, well, when should we cancel services, for instance, what would your thoughts be on that?
It's a very hard decision, and you know, I think the governor set us up pretty well with this new rule of up to 500 or 500 and over canceled. Beyond that, 50% occupancy. Taking an extra step to actually cancel. You know, I think each congregation will kind of have to look at their own makeup of who they have and what that means for their people.
And we have about 30 seconds left. So if we're to learn anything from this that would kind of go beyond this event itself, what could we learn from this?
I mean, I think the biggest thing is to protect your neighbors, protect those who can't protect themselves, washing your hands, and really making sure highly touched surfaces are cleaned regularly.
Well, Rebecca, it's been amazing and very illuminating conversation to have you on. We should probably have the Director of Public Health on more frequently, and in another time when we can just talk about something other than COVID-19. But thank you for being on.
Thank you.
And for all of you that are watching today, I hope that you would be safe today, that you would take care of each other, and be gentle with yourselves.